There is a new clinical report on atopic dermatitis from the AAP, and the goal is to empower pediatricians who may not always feel comfortable with treating atopic dermatitis. Hi, I'm Jennifer Schoch. I am a pediatric dermatologist, and I am one of the lead authors on this clinical report on atopic dermatitis. Atopic dermatitis is a really common problem. It affects up to 20 to 25% of children, and the number of healthcare visits, particularly for pediatric atopic dermatitis, is increasing. Pediatricians are usually the first in line to see children who have atopic dermatitis. Many pediatricians might not feel comfortable treating atopic dermatitis, in part because we really have created a lot of fear around some of the topical therapies available. We hope that this report will empower pediatricians to use topical therapies appropriately, widely, and as needed to help control this chronic problem for our patients. Children are usually diagnosed in infancy, but not always, and understanding the specific patterns of how atopic dermatitis presents in different age groups will help to aid the clinical diagnosis. Most of our children with atopic dermatitis have a family history of either atopic dermatitis or atopy in general, and that can aid in making the clinical diagnosis, particularly if you're uncertain if you're looking at eczema or something else. Atopic dermatitis is a condition that affects the skin, but also affects the child as a whole person. Particularly, we see impacts on mental health, and atopic dermatitis is associated with increased rates of anxiety and depression, as well as sleep disturbances. We hear from parents all the time that sleep is majorly affected by atopic dermatitis, and better treatments can help to minimize that sleep disturbance. Additionally, particularly for older children, eczema is a really visible disease, and other children might think it's contagious. It may interfere with sports, or it may just make them uncomfortable while they're participating in outdoor activities. For example, in my clinic, I see children every day where the parents aren't getting sleep because the infant is up all night scratching, or toddlers who don't really understand about the eczema and why it's keeping them up, but just have poor sleep and have poor sleep habits because of the eczema. We also see teenagers all the time who are trying to not go to school because they're embarrassed about how the eczema looks. This is why it's so important that we have effective treatment regimens for our families, and that families understand what the treatment regimen is and why it's important. It's really important that as pediatricians, we make sure that we help families understand that atopic dermatitis is a chronic disease. And sometimes when we treat it as if a topical medicine is going to cure it, it can be really confusing to families when the disease continues to be chronic. One of the things we work with parents on right away is to help them understand why atopic dermatitis happens, what we know about it, and why each step of the treatment is important to address that part of the chronic disease. The resources included in the clinical report are an example of an action plan, which pediatricians can adopt to their own style to have a written plan with families for, again, those chronic maintenance routines that we all have to have for our atopic patients, as well as what patients should do for flares. There's also a general outline of what bathing, maintenance skincare looks like, and we hope that pediatricians feel more comfortable with what maintenance regimens look like. We really hope that after reading this clinical report, pediatricians will be able to walk away feeling, first of all, that they understand that atopic dermatitis is a disease that affects the whole child. Additionally, we really want pediatricians to feel more empowered to use topical therapies, to feel comfortable with topical therapies, and to really work in maintenance regimens as well to topical therapies. And that's, I think, one of the highlights of this clinical report, particularly compared to the previous. And then finally, we want pediatricians to understand that we really want them to treat mild and moderate atopic dermatitis, but we want to be available as subspecialists to help when they need to refer patients to us. So we want pediatricians to walk away knowing when it's time to refer to subspecialists as well.